Nassau County has teamed up with the New York Islanders to battle drug addiction on Long Island.
Hockey can hurt, but no amount of pain can compare to the heartbreak of losing a loved one to addiction. In 2016, 195 lives were lost due to drug overdoses in Nassau County. In 2017, that number was 184.
I'm Nassau County District Attorney Madeline Singas. In hockey and with addiction, the more saves, the better our chances of winning. Let's stop the pain. Go to heroinprevention.com.
Well, that was a new public service announcement with Islanders Matt Martin and Nassau County District Attorney Madeline Singas, who joins us this morning. Good morning.
Good morning. Thanks for having me.
Welcome. Now, we just saw some numbers there and a very impressive PSA. Let's just talk about how bad the crisis is in Nassau County.
Well, it's bad. It's bad throughout the country. In Nassau, we're dipping a little bit. As you saw, the OD numbers are coming down, and there's a glimmer of hope there. We're hopeful that we're turning a corner. But, you know, one person dying of an opioid overdose is too much for us. So we're doing everything we can in terms of prevention, in terms of educating people, getting out into the schools, talking to parents, talking to children, treatment. We've poured a lot of money, asset forfeiture money that we've seized, mostly from drug dealers, so it's sort of ironic, and we're putting it right back into treatment to make sure that people get the help that they need. And, of course, enforcement. And, you know, we're coming down hard on people who are trafficking large quantities of heroin and other opioids into the county.
You know, as reporters who've been covering this now for a few years very seriously, the one thing I always hear is, I didn't think this could happen to my son or daughter or my family.
Right.
What do you tell kids as a mom who, whether it's, you know, they get addicted because they're playing sports and they go on painkillers, or because they see people around them trying it? When do you start having that conversation?
Well, we start early. You know, we're in high schools. I have prosecutors in the high schools, you know, several times a month. We have a program called Not My Child, because that was the problem, right? Parents were saying, no, not my kid. You know, I've talked to parents who have children who are, and partners and sisters and brothers who are full-blown heroin addicts, and they said, you know, I didn't know. I thought my kid maybe drank a little bit, smoked some marijuana. I had no idea they were using heroin. So the message is, be involved, talk to your kids. If you notice any changes in their behavior, if you notice that their money is missing, things like that, be aware of. If they're under a doctor's care with opioids, make sure that you're on top of them, that you talk to your physician about weaning them back off of those drugs so that they don't get addicted. And we have a great website, heroinprevention.com, and I urge people to go on it to look for help. And the thing that we're doing mostly is just talking about it, taking away the stigma. So if you think there's a problem there, let's talk about it. Teaming up with the Islanders was just fantastic for us, because kids get to see their sports heroes talking about an issue that's so important, and they're saying, reach out for help. You know, we're here to help you. We can get you the services that you need. So I'm so grateful to the Islanders and to Matt Martin especially for doing that.
Tell us about the Community Partnership Program.
Yeah, so we're in our community in Hempstead, and it's a resource center, and basically we provide everything from food to suits that people can wear on interviews, to vocational training, to re-entry services, going into the jail when people are about to be released, and making sure they have a plan. How can we make sure they find jobs, they have apartments, working. You know, some people just come in off the street. It's right on Main Street, right in the heart of Hempstead. Whatever issue they're facing, if they're in crisis, they can come in and talk to professionals, and we can lead them and connect them with services real time so that we can assess what's going on and help them overcome those issues.
We just saw you cutting the ribbon to that center. Thank you so much. And an important conversation to have, and we thank you for having it with us. Well done on all the great strides you're making.
Great. Thanks so much for having me.